This video is going to discuss the latest trend in facial rejuvenation, microneedling. Microneedling is a safe and effective means of reducing fine lines and wrinkles of the face, treating acne scars and scars in general, reducing pigmentary issues such as hyperpigmentation and the very difficult to treat melasma, and potentially an adjunct to hair regrowth. Hi, I'm Dr. Messina, and microneedling is very safe and effective. Is it as good as a fractionated CO2 laser in rejuvenation? No, but it's a fraction of the cost with a fraction of the downtime. So it's a win-win situation. And in fact, it's probably the ideal starting point for anyone looking to just start an anti-aging or rejuvenation program. In the 3 years that I've been offering it, it's become one of my favorite treatments to do, and I use it as an adjunct to radiofrequency skin tightening. Since this video is going to be all about microneedling, we're going to discuss where it came from, how it works, who it's good for and who should avoid it, because it's not good for everyone, what you can expect before, during, and after your procedure, and we're going to touch upon all the devices that are readily available to the general public. Microneedling is actually not new. It's been around for almost 30 years. It started as subcision. Some doctors noticed that if you had a depressed scar and took a sharp needle and worked under the scar, basically unearthing the base, that scar tended to remodel over the next few weeks. Move ahead 30 years, and now we have devices that release a precise depth of a number of sterile needles, allowing you to treat a broad area versus just a single little scar. Microneedling works on a two-pronged system. The first thing is it reduces the integrity of our skin. Our outer layer of skin offers a lot of protection, and those microneedles piercing it and going down to various depths now reduce that integrity. However, they allow products to be absorbed much deeper and more readily than they would if you just put them on unpunctured skin. So if you're using an antioxidant, the odds are if you're just placing it on your skin, you're really not going to be getting as much absorption as you think. However, after a microneedling or even during a microneedling, you're going to get that antioxidant deeper into the skin. And that breaking down of that protective skin barrier is really a double-edged sword. It allows for topical agents to be absorbed to a greater extent and more rapidly than they would. However, it also allows for products that might cause irritation to get absorbed. Recent studies have shown that the application of vitamin C during or shortly after a microneedling procedure might lead to an allergic reaction called granuloma formation. That's when the skin senses a foreign object in it, and it tries to wall it off, and it makes these hard, firm nodules in the skin. So you have to be very careful with microneedling and the use of vitamin C type products. The second prong is due to the controlled wound that's created. Once you have that wound, you initiate a cascade of healing that brings a lot of wonderful substances to the area, such as fibrin. We're seeing that now in platelet-rich fibrin, which is becoming one of the newer therapies for rejuvenation, especially perioral and periorbital rejuvenation. It also increases collagen. It's called collagen induction, and that increase in collagen in the area offers most of the rewards that you get from microneedling, specifically the reduction in fine lines and wrinkles. Whereas this therapy is very safe and effective, there are certain conditions that you really shouldn't be doing microneedling. First, if you have very sensitive skin, atopic dermatitis or rosacea, you might be very sensitive to microneedling. I would think twice about doing that. If you have an active infection, even if it's just infected acne, you do not want to microneedle that. You could spread the contamination throughout other areas of your face. If you have an active cold sore, You don't want to do microneedling, and if you're very prone to them, you should be taking an antiviral before you start this therapy. Finally, if you have a darker complexion, you are already at risk for developing hyperpigmentation. What's really wonderful about the new devices is the ability to adjust the depth and the rate of penetration. And that's very important because we're usually using a depth from 0.5 millimeters. Some will go to actually 0.25 millimeters. But for the most part, we're 0.5 millimeters to about 2 millimeters. And the increased depth is going to give you the more profound results. However, increased depth also means increased risk of complications. Therefore, I never recommend a layman doing their own deep microneedling procedure. So now let's look at some of the available devices that are out there. First, you've probably noticed by now, I have Professor Scruffington with me. Professor Scruffington is a little traumatized because we went out in a heavy rainstorm and I didn't realize these Havaneses get all tangled up when they get wet, and he had to get trimmed, so he's 1/3 of his usual size. So he's feeling very sensitive today, and he wants to be held, right? Okay, Lorenzo. Professor Scruffington here. First, we have the dermal roller. Very, very popular, very inexpensive. You could find them on Amazon for as low as $30 and as high as about $200. At $200, it has a lot of bells and whistles, such as an LED light. I don't think that's worth it. I don't think you're going to get any benefit from that LED light. But if you want a fancy dermal roller, it's there. The sterile needles on a dermal roller tend to be about 0.5 millimeters. If you find a roller that's only 0.25 millimeters, it's really not going to go deep enough to have any appreciable effect, and you might be wasting your time and money. It's certainly not going to treat acne scars or deeper lines and wrinkles. The reason for the small needle is for safety. You have to understand that the average person is going to overdo it. Therefore, by having a small needle, you reduce the overall trauma. However, if you go on YouTube or TikTok, you're going to see hundreds of videos doing it completely wrong and injuring themselves. It's supposed to be vertical rolling, horizontal rolling, diagonal rolling. You're not supposed to be going at all different angles on the face because now you're cutting the skin instead of puncturing the skin, and it makes a difference. So if you're going to do your own dermal roller, you have to be mindful of how you're doing it, and specifically mindful of what you're going to do in the thinner, delicate skin areas such as under the eyes. The next are the stampers. I like the stampers because they tend to go in one spot. You put it on, stamp, move, put it on, stamp, move. There's a lot less redundant puncturing with a stamper. My favorite stamper is the Cure because it has a serum in it. And that serum, you screw on this sterile gold needle cap, let the serum fill the needles, and then you puncture with that. The Cure stamper, I think, is a really nice way of using microneedling to augment the absorption of extra products that you might be putting on the skin. And then finally, we have micropens. These micropens could be as little as $120 on Amazon, up to thousands of dollars for a medical grade one. My preference, and what I use at the office, is the Cosmopen by Cosmofrance. It's just under $2,000. However, it's a very precise device, and that's what I want for my patients, precision and accuracy. It comes with a package of single-use sterile needles that are easily attached to the tip. I'm able to adjust my depth from 0.5 millimeters to 2 millimeters on the fly, as well as change the rate at which I'm making these punctures. So if I'm working on a thicker tissue, such as your cheek, I could use 2 millimeters. When I move to the forehead, I could go to 1 millimeter, 1.5 millimeters. When I'm working under the eye, I could reduce it down to 0.5. So it gives me a lot of flexibility. And again, single-use sterile tip. So now let's talk about the preparation for getting a microneedling. Microneedling, because it's puncturing the skin, does have a risk of creating an infection. Therefore, first, all makeup should be removed. The skin should be thoroughly cleansed. I then put on a topical agent such as BLT cream. The reason why you might need this BLT cream is because when you're using a deeper depth, once you go over 1 millimeter, it's going to hurt. Once that's removed, I sterilize the skin with alcohol to make it as sterile as we could possibly get it. So after we've completed that, I place a fine layer of usually hyaluronic acid serum on the skin. It just helps the pen glide across the surface. Usually we start in a horizontal, followed by a vertical pattern, and then a circular pattern. The end point is a reddened skin with pinpoint bleeding. Then I stop. Afterwards, you can add an antioxidant serum, but you have to be careful what you add because the skin is open and there's always a potential to create an allergic reaction or some kind of hypersensitivity to whatever you're putting on the skin. So that step is plus and minus, and that is done on an individual basis. After we're done, you have to be very careful with your skin. You do have punctures, the integrity has been reduced, you're more sun sensitive. So it's very important to wear a quality sunscreen, usually one that has zinc and or titanium in it, physical block. And to wash the face to keep it as clean as possible over the next few days. Although the healing will probably be done within the first 24 hours, it's really advisable to avoid extraneous products and makeup on the skin for anywhere from 1 to 2 weeks. And the treatments should be done every 2 weeks to every month, depending on what we're targeting. If you want simple rejuvenation, a few fine lines and wrinkles, then you could go at a lower depth and do it every other week for about 3 to 4 sessions. If you're treating scars, however, you're going to want the increased depth, and you're going to probably do it every other week for about 5 to 7 treatments. And the downtime, even for sensitive skin, is really only a few days. So you can see that microneedling is a very safe and effective method of getting facial rejuvenation. I hope you like this video. If you want to hear anything else about microneedling, or you want me to discuss in depth some of those at-home do-it-yourself products, let me know and I'll make another video regarding it. Take care and have a good day.